This is our story about EDS. No, we are not a doctor, so please understand that this is our personal story and we would like to share to spread awareness. With curtain. All right, hello guys. I'm back, I guess. Haven't recorded in a long while. I don't know if many of you guys know that I guess I've been sick, I guess you could say, right? Mm-hmm. Is that how you put it? Yeah, sure. I was diagnosed with Ehlers-Danlos syndrome almost 3 years ago. And May is EDS Awareness Month. So I am going to have Kate, my daughter Morgan. We all have EDS. We all have different severities. So we're going to kind of go like that through everybody else's stories.
Not only that, but we have the same type of EDS. We're all hypermobile EDS.
Right. So we're going to start with Kate because she's been dealing with it longer than we have.
I was officially diagnosed almost 5 years ago now. But my whole life I knew that I was sick and that there was a problem. My very first symptoms of Ehlers-Danlos syndrome showed up directly right after I was born. I was born with lazy eye in both of my eyes. And the doctors had to perform 3 surgeries from the age of 1 until 3 years old on my eyes to try and correct them. And they've gotten them as straight as they possibly can, but there's been talks now about when I will lose the vision in my left eye and how the vision is slowly deteriorating in the right eye because your eyes are basically made of collagen, connective tissue, and that's the connective tissue that Ehlers-Danlos affects is the collagen gene. And collagen is literally in every building block portion of your body. It is part of your bones, it's part of your muscles, it's part of your tendons, it's part of organs, your nerves, it's part of your brain, it's part of all of your organs. Your organs are completely made out of connective tissue, so that puts us at risk for organ rupture, venial rupture, aortic dissection, and lots of other major complications. When I was 3 years old, I had my first vascular symptom. I was in Head Start, which is like a preschool group, and we were touring the local ER to get educated about the medical system in our area. And because I had had so many trips to the ER because I had fallen and cut myself and needed to be glued back together or stitched back together or whatever the case may be, I fainted at 3 years old, which is actually pretty uncommon for a 3-year-old to do. And that's been something that's happened to me my entire life. And then also with that, I used to get extremely high fevers for no reason.
You want some blood? Just kidding.
And then I used to get extremely low temperatures for no reason. Well, all of this has come to fruition now as an adult. I can vocalize my symptoms a little bit more and be able to get the diagnoses that I need, and we found out that I have a diagnosis called POTS, and that is under the big umbrella of dysautonomia. Now, POTS is called posterior orthostatic tachycardia syndrome.
That's a mouthful.
Yeah, I was just about to say that.
It is.
When you have posterior orthostatic tachycardia, what happens is your blood vessels aren't strong enough in the lower portion of your body to force the blood up to the upper portion of your body. So basically the blood ends up pooling down in your legs. So if you try to then change any position from laying down to sitting or from sitting to standing, it has an effect on your heart and your blood pressure. Your blood pressure bottoms out, and your heart rate then goes into a tachycardic level, trying to raise your blood pressure to prevent your body from stopping functioning. And that's something that I've had to deal with my entire life. We didn't know that until last year, that it actually had a name and that there were treatments for that. And the treatment for it is something that most people will never hear in their lifetime. Most people always hear actually the exact opposite of what the treatment for POTS syndrome is. The treatment for POTS syndrome is 100 ounces of water, and half of that 100 ounces of water needs to be highly concentrated with sodium. And sodium is what here, folks? Salt. So I am just the opposite of everybody that has hypertension. I have hypotension, and I have to eat tons and tons and tons and tons
together.
of salt.
No wonder we're so salty.
Exactly. The other issue that I personally have is I have vascular issues to where my veins and arteries get aneurysms. And so I have to go for regular CT scans to look at my vascular system to make sure that everything is working and functioning properly, and to make sure that I don't have any aneurysms that have popped up that will create any type of blood clots.
What's a CT scan?
It's a CAT scan. It's where you go in, and usually they do it with a contrast dye, and it's a high amount of radiation to where they can look at all the different systems of your body. They can look at your muscular system, they can look at your bone structure, they can look at the tendon system. It just depends on what T weight they put the CT scan machine at as to what system they're going to look at.
I guess we should probably say that all three of us have EDS. And it used to be type 3, but now it's considered hypermobile Ehlers-Danlos syndrome.
Or HEDS.
Or HEDS for short. You're done? No, because you got a whole list of...
Yeah.
We could be here for 4 hours and she
Right.
could still go on. So kind of like...
When I got my diagnosis, we're going to jump ahead quite a few years, by that time I had already had 14 surgeries to correct various issues: bone structure, muscle structure, cartilage issues, and whatnot. When I went to my geneticist, get this, folks, Dr. Howard Stern diagnosed me. He looked nothing like the radio man at all.
I was going to say,
He was a
any
short-
relation?
He was a short, very, very, very serious man.
Don't even know who that is.
He did not have a comedic bone in his body. But anyways, on
That's
my
funny.
testing, and everybody who goes for any type of genetic connective tissue syndrome testing, they get tested on what's called the Brighton score. And this is even continued through the new nosology. And on my Brighton score, the top number on a Brighton score is 9. And on my Brighton score, I got an 8 out of 9. And the only reason I got an 8 out of 9 was because I wasn't able to take my thumb and fully pull it
You can't? Like
to
this?
my wrist. I have, yep.
I could.
The reason being that I can't do that is because for years and years and years and years, I played the piano. I
So
played the
strength
trumpet.
and-
I played the flute. I played the clarinet. I played the French horn.
So she had a lot of muscle.
So I have a lot of muscle strength and a lot of tendinal strength. But if you can see from there, I still have a lot of hypermobility as far as where it
EDS gang
goes.
sign.
You know, but I also have the 90-degree angle and even further
Yeah,
that
see,
other
I can't
people
do
And
that.
see, and I don't.
Yeah,
Well,
I can't.
I don't know. I guess so. They never really did that one
Yeah.
up there,
But
though.
I can
Yeah, but
shake
she can
someone's
go.
hand like this. Like here.
Yeah, I
Go.
know.
Let me shake
Oh,
your
look
hand.
it. They can slap.
Yeah. You know, that's
clap.
That's
Yeah.
you know, yeah. You know, or
So otherwise, they're known as party tricks.
yep.
We're not supposed to do them, but
Exactly. And with that brings me to one of my most favorite statements for Ehlers-Danlos syndrome is we're all zebras, but us being zebras, we all have our own different stripes. And that means we all have our own symptoms. It just all falls under this big umbrella category of Ehlers-Danlos syndrome. I'd also like to talk about expenses. The expenses of having Ehlers-Danlos syndrome. It is absolutely ridiculous. You
Devastating.
have medical expenses that you will never even expect to have. You will have surgeries that will shock you. I am 36 years old and I have a colostomy bag for the rest of my life because of my Ehlers-Danlos syndrome. It's
yay, poop!
Yeah, I can poop again. Yay! So, and it really just kind of comes down to people really need to understand and get some knowledge about Ehlers-Danlos syndrome because really it might be rare and uncommon, but the funny thing is these ladies that I'm sitting here with, I've known both of them for the majority of my life.
You've known Morgan since birth.
I've known Morgan since since she was born. I've known Kwani since I was a teenager. And we all have Ehlers-Danlos syndrome.
First, she told me she had it, and I'll be honest here. I was like, okay, it's Katie. She's a hypochondriac, because this is like way before anybody knew what it was, and we always and it's not only me, but there's been other people thinking that, okay, she's just trying to get attention,
That didn't help that other people's opinions shaped ours.
Right. But then, I guess it kind of switched when Morgan got diagnosed. And it kind of opened my eyes just a little bit more to go, okay, wait a minute. She's not full of shit.
And how can somebody fake
right
since birth?
Right, and that's what I'm getting now.
Yep.
Because I've only known about mine for 3 years.
Right.
Going up on 3 years.
Right.
And I don't know how many doctors' offices that I've walked out of in tears. Because they were saying, oh, well, she's just a drug seeker. Or
pain management.
Or, she's just fat and lazy and she needs to get off her ass. And yes, doctors have said that to me.
Yeah, I've had doctors say certain things like that to me before also, and then once I went from 265 pounds down to the between 150 160 pounds that I am now, and I show them pictures and I tell them, look, I exercise on a regular basis. I've maintained my weight for over 7 years now, even through a pregnancy. And so they can't tell me that I'm lazy. They can't tell me that it's all in my head because I've got a whole plethora of imaging and stuff and other diagnoses that go along with the Ehlers-Danlos syndrome alongside with these ladies too. They have their diagnoses and everything that fall under the umbrella of Ehlers-Danlos syndrome, and it is a very difficult disease or syndrome to deal with because not only is it forever and there is absolutely no cure and no, we can't get collagen injections to make our collagen
Although
better.
many people think we can.
Although many people think that that's the answer, that is definitely not the answer. Our body is we're like the X-Men. We have a mutated gene, and so our collagen is mutated, and so when we're injected, With unmutated collagen, what our body does is it goes in and
Defense.
it actually mutates that collagen.
Oh.
And so it becomes defective collagen, so additional defective collagen in our bodies. So the only thing that we can do in defense and to protect ourselves is to manage our symptoms and actually be proactive about our symptoms instead of retroactive, which
water,
which really confuses a lot of doctors, because a lot of doctors are used to seeing patients when they are sick and when they are needing help instead of there for proactive management, unless it's a diabetic patient or a patient with hypertension or something that they're used to dealing with instead of these rare syndromes and disorders. Okay, I think I'm done.
5 hours later.
I guess I'll go. Like how my mom said, she didn't really know about it when Kate told her, but I believe you were diagnosed a year after me. So my diagnosis was almost 4 years ago. The reason why I went in was because I got bullied and I got thrown up against the lockers and my hips kept coming out of place and snapping. So I went to the doctor, and I originally got diagnosed with hypermobile joints. Then a few months later, I saw a geneticist, and she told me, you have Ehlers-Danlos syndrome, and you need to have your mother and siblings checked because it is genetic.
I didn't know she was in the shop.
So
I was like, wait a minute.
After that, it didn't really set in until maybe 2 years after the diagnosis. 3 years after the diagnosis, because it affected my college life. I couldn't continue with cosmetology because of my disease. I couldn't keep up, no matter how hard I was trying, and the school wasn't able to help me. So I had to drop out, which was crushing to me, because I'm 21 years old. I had to leave college because of an illness. I can't work anymore because with the Ehlers-Danlos, I have sliding rib syndrome, where the ribs on this side will slide out of place. I have snapping hip syndrome. I have kyphosis, and I'm just special, and I have the rare part. Kyphosis is the hunchback. I have the rare part where it's
The hunchback of scoliosis.
Yeah, the hunchback of scoliosis. I have the rare part where it's in my lower back and hip region, and my spine curves inwards towards my stomach, so it always makes me look like I have a pregnant gut when I'm not. It's just food.
And it's kyphosis lordosis.
Oh, I didn't know that. I just kept reading it as kyphosis.
No, it's when it's in the low back, it's kyphosis lordosis.
See, they never told us that. They just told us it was
Yeah,
kyphosis.
I have that diagnosis because of my T1, T2, T3, T4, and S1 discs are all bulged because of it.
And then with the kyphosis, and the other word she said,
Lordosis.
my back won't stay stable. My top half will move this way, and my bottom half will move that way. And there's nothing that can strengthen it. I've been in and out of therapy. Therapy does help with the pain, but it's not going to strengthen my joints as much as I try, because with our joints, they don't ever tighten. That's why we can't go see chiropractors, because chiropractors bend and twist until they get tightened.
You can see chiropractors. You just have to do your work and make sure that they are aware and they know and have worked with other people with EDS.
And not many of them.
And actually, physical therapy is extremely important to be doing on a regular basis, because it's not so much about tightening the joints, it's tightening the muscles around the joints and making the muscles themselves stronger so that the muscles hold the joints into place. So with your back stuff, yes, you could do physical therapy. You
Yeah,
just
my
have
muscles
to get,
are strong.
Her problem is the lady that she was doing PT with.
You have to be right with the right physical
Right.
therapist.
She
It
was
really
like, "Oh
takes,
yeah, let's do 4 times and then you're good."
Right, no,
it's not a quick fix.
it takes a really good physical therapist. You have to get basically what you call your doctoral team. Wherever you live, you have to find your doctoral team, and that means that you have to doctor shop. So you are gonna have to go in and have several, intake appointments with doctors until you find one that is comfortable working with you. And that means cardiologists, physical therapists, orthopedists.
That's why I go down to Green Bay for cardiologists.
Ophthalmologists.
Oh, that's why I switched my primary care doctors, because
and then endocrinologists.
My first one, I've been trying for months to go see either a neurologist or an endocrinologist because I can't control my body temp. It can be 0 below outside and snowing. I can walk out in shorts and a tank top and my skin be as red as a tomato because I'm overheating. It can be 80 degrees out and I'm freezing. And I don't know what's going on. And my original primary care doctor told me there was no point of going to go see a neurologist or an endocrinologist, because if it was a thing with EDS, what can they do to help?
Well, and it's not only that, but you are young, and that's the problem with the EDS and patients getting diagnosed, is especially for younger people. They get the diagnosis, and then you go in and you tell the doctor this, and they kind of brush you off because they're like, well, she's too young.
EDS.
Yeah, she can't have this because she is only 19, or she can't have this because she is only 21. Well, in reality, we do.
Yep.
And the doctors just need to take a step back
and be willing to learn.
and be willing to listen. Not so much learn, but actually listen to their patients.
Yeah, and hearing what their patients are saying.
Instead of going, oh, okay, well, she's like the 7th patient I've seen today. See you later. You've gone through this.
Oh yeah,
I've gone through it.
With my colostomy especially.
Right.
I went down to Ann Arbor for an appointment with their GI specialist because I was having digestive issues. My weight had actually dropped down to 125 pounds, and I was getting sicker and sicker and sicker. And the doctor, and because I had been diagnosed with irritable bowel syndrome before, the doctor down there literally laughed at me and said, "You don't even have Ehlers-Danlos syndrome." So I had him pull up, because I was down in Ann Arbor where I originally had gotten diagnosed. I had him pull up my diagnosis and read it out loud to me. And then I proceeded to argue with the doctor, and I walked out of his office. And of course I was really, really upset and in tears, and came back and I reported to my general physician what had happened, and she was actually absolutely appalled with the whole situation and what had happened, and immediately turned to Mayo Clinic. And I was immediately accepted into the Mayo Clinic facility because of my diagnoses and all of the issues that I have going on. So we did Mayo Clinic, and that's when they figured out that I didn't have a large bowel that was basically working. I had an obstructive disorder, and everything was backing up so much that it was just coming out the top end. And there was nothing that I could do for it except for have my large bowel disconnected from my small bowel, and my small bowel diverted out my stomach in what's called a Hartman's procedure. That was a year. It took me a full year to get that procedure done, after the doctor in Ann Arbor.
And the fights and the frustration.
After the doctor in Ann Arbor had laughed me out of his office. It had taken a year for us to figure out what to do and where to go, and
many phone calls,
many
venting to me and crying, and it's.
I wasn't able to get my kids off to school. People had to do it for me because I couldn't get up in the morning because I was so sick all the time. My skin color was gray.
Yeah, you were looking pretty sickly.
Oh yeah, I was gray. I was gray. I know it.
So was I when I was a baby.
But she's not a baby.
I know. Sorry. ADHD is like, oh, hey, connection.
Sparkly.
And I guess I'm lucky with some doctors because I went to hand therapy while I was in cosmetology. And I was her first case ever with EDS. So she did a bunch of research. And we did a lot of stuff to figure out what was wrong and what I could do. And we figured out, because she poked my fingers with needles and I couldn't feel them. While doing laundry, when I pull stuff out of the dryer, I have to have people check it because I can't feel if it's wet or dry. I can feel if it's hot or cold, but I can't feel if it's wet unless it's sopping wet. I don't have enough strength in my hands to grip, so I grip harder than I should, just out of instinct. So I do have wrist braces that keep my wrists mobile, but still stiff so I don't hurt them. And then, I'm trying to think. I think he's orthopedic?
What doctor?
Dixon.
Orthopedic.
Yeah,
who's
orthopedic.
fine.
My orthopedic doctor, I went to him November of last year because while I was working, I sustained a back injury in the lower center of my spine. I was on the ground cleaning something and I couldn't get up. So I went in and we found out I did something to the muscle which triggered me to have sciatic nerve pain, because that's fun. He asked me to stop working, and at that time I told him I couldn't until I got disability. So he told me to file for disability and to stop working to prevent myself from getting hurt. I went to therapy, I got a back brace, I'm appealing my disability case because they denied me, because their doctors looked over my medical stuff and told me I can still work, I just have limitations. Which that is true, but what my doctor also said is true. If I continue, I will hurt myself more, and later on in life, I won't be able to do much.
We, as Ehlers-Danlos patients, tend to be more of a liability at work than an asset at work. So that's what makes it so difficult for us to get a job, because we don't know what's around the corner. Literally. One day it could be my hip dislocates, the next day it's a blood clot in the leg, and then the next day it's benign proximal positional vertigo going on.
Or you can't call work and say, hey, my chronic fatigue is so bad that I don't feel safe to drive.
Right.
Nobody really understands that you can be so fatigued, like you just ran like a freaking 15-mile run.
And all you did was make breakfast for the kids.
Right. Or even if you just made it out of bed and crawled your butt to the bathroom to go to the bathroom. Mm-hmm. Been there, done that.
So I have a quick question. Do you guys remember your Brighton scores and where you guys landed on the Brighton score? What was your Brighton score, Connie?
It was a little under what they will diagnose you.
Right.
It was at a 6. It wasn't that high because I am older.
Right, exactly.
Because I am going to be 40 this year, so you kind of lose your
mobility due to arthritis.
Right. I do also have osteoarthritis in both knees.
Right.
So I can't do a lot of walking, but I have more, I think I even have more mobility devices than you. Because there are some days...
You have the wheelchair, and that's the one thing that I don't have that the doctors have suggested for me to have. And that was a while ago, but we all know how stubborn I am as in comparison to a lot of other people.
I'm there. I am bullheaded, I am stubborn, but I also know that I do have to take a step back and look at the situation, because yes, I'm married, but he's not here. Yep. He is in Okinawa. Mm-hmm. So for the safety, for me to be able to continue, and we homeschool, so...
And let's get real here. How many kids you got?
I have 4.
Yep.